As we grow older, many people begin to notice something unsettling about their blood pressure. The numbers no longer behave the way they used to. Some days the reading looks perfectly normal, yet the body feels tired, lightheaded, or slightly unsteady. On other days, the numbers appear higher than expected, even though nothing unusual seems to be happening. This creates confusion, and confusion often turns into quiet anxiety. Many seniors are told to focus on one blood pressure number. They are taught that if the number looks good, everything must be fine. And if the number looks high, something must be wrong. But after the age of 60, the body no longer works in such a simple, mechanical way. Blood pressure becomes more sensitive to daily changes. Arteries gradually stiffen. The nervous system responds differently to posture, sleep, hydration, stress, and even breathing patterns. Because of these changes, a single blood pressure reading can be misleading. This does not mean blood pressure is unimportant, and it does not mean medical advice should be ignored. What it means is that numbers must always be interpreted in context. Doctors who specialize in senior health rarely rely on one isolated reading. They look at trends over time. They consider balance, energy levels, mental clarity, and how a person actually feels throughout the day. Some older adults have readings that appear perfect, yet feel weak or dizzy. Others see higher numbers but feel stable and clear-headed. This difference is not imaginary. It reflects how the aging body adapts and compensates. In this video, we will calmly explain why one blood pressure number can lie to you after 60. We will look at what truly changes inside the aging cardiovascular system, and we will explain how doctors actually think when protecting senior heart health. This is not about fear. It is not about stopping medication. It is not about ignoring professional guidance. It is about understanding your body more clearly so you can approach your health with calm, informed confidence instead of worry. Let us begin by looking at the number most seniors focus on first, and why it does not always tell the full story. Many seniors are told to focus mainly on the top blood pressure number. This number is called systolic blood pressure. It measures the pressure in your arteries when the heart contracts and pushes blood forward. The bottom number is called diastolic blood pressure. It reflects the pressure in your arteries when the heart relaxes between beats. On paper, this seems simple. But after the age of 60, these two numbers no longer behave the same way. As we age, arteries naturally become stiffer. They lose some of their ability to expand smoothly with each heartbeat. Because of this stiffness, systolic pressure often rises, even when the heart itself is working normally. At the same time, diastolic pressure may stay the same or even decrease. This creates a wider gap between the two numbers, something doctors call pulse pressure. This is where confusion begins. A senior may see a higher systolic number and assume their heart is under immediate danger. But in many cases, this rise reflects age-related arterial changes rather than active disease. On the other hand, a very low diastolic number can also create problems. When diastolic pressure drops too low, the heart may receive less blood during its resting phase. This can affect balance, energy levels, and even increase fall risk. This is why experienced doctors do not look at systolic or diastolic numbers in isolation. They look at the relationship between them. They look at symptoms, posture changes, dizziness, fatigue, and how the numbers behave over time. A single high systolic reading does not always mean aggressive treatment is needed. And a normal-looking diastolic number does not always mean circulation is optimal. Understanding the difference between these two numbers helps reduce fear. It allows seniors to ask better questions and avoid reacting to one number alone. In the next section, we will discuss why doctors care more about trends and patterns than isolated readings, and how this changes blood pressure decisions after 60. Many seniors feel anxious after seeing one unusual blood pressure reading. A single high number can trigger worry, fear, or the urge to act immediately. But in medical practice, one reading rarely tells the full story. Blood pressure naturally changes throughout the day. It rises with stress, movement, pain, or poor sleep. It can fall after meals, during rest, or when standing up too quickly. Because of this, doctors are trained to look for patterns rather than isolated numbers. A true blood pressure problem shows consistency. Readings stay elevated across different days, times, and conditions. They do not appear once and disappear the next day. This is especially important after 60. As the nervous system ages, blood pressure regulation becomes less stable. Small changes in hydration, posture, or emotional stress can create noticeable fluctuations. This does not automatically mean something is wrong. For example, a higher reading in the morning may return to normal by afternoon. A slightly elevated number during a stressful moment may drop after rest. These variations are often normal responses, not warning signs. Doctors also look at how blood pressure behaves with position. Does it drop when standing? Does it spike suddenly and then normalize? These patterns provide more useful information than a single measurement taken in isolation. This is why keeping a simple log can be helpful. Noting time of day, posture, symptoms, and recent activity adds valuable context. Reacting to one number alone can lead to unnecessary fear or over-treatment. Understanding trends helps seniors make calmer, safer decisions with their healthcare providers. In the next section, we will discuss why symptoms often matter more than numbers, and which signs doctors take seriously in older adults. Many seniors focus closely on blood pressure numbers, but experienced doctors know that numbers alone are not enough. How you feel often matters more than what appears on the screen. Two people can have the same blood pressure reading, yet one feels perfectly fine while the other feels unsteady or weak. This difference is important. Doctors pay close attention to symptoms because symptoms reflect how well blood flow is supporting the brain and the rest of the body. For example, dizziness when standing, lightheadedness, sudden fatigue, or blurred vision can signal that blood pressure regulation is not keeping up with daily demands. Even if the numbers look acceptable, these signs deserve attention. Another important symptom is balance. If a senior feels unsteady when walking or standing, this can indicate that blood pressure drops briefly with posture changes. This is something a single-seated reading may not reveal. Doctors also listen carefully for changes in mental clarity. Difficulty concentrating, unusual confusion, or sudden weakness are never ignored, regardless of what the numbers show. This is why medical decisions are rarely made based on one reading alone. Doctors combine numbers with symptoms, posture response, and overall function. It is also why aggressive lowering of blood pressure is not always the goal in older adults. If numbers are pushed too low, symptoms may worsen instead of improving. This does not mean blood pressure should be ignored. It means it should be treated with balance and context. Seniors are encouraged to report how they feel, not just what the monitor says. Describing symptoms clearly helps doctors adjust care safely. Understanding this reduces fear. It reminds us that the body is more than a number, and good care always looks at the whole picture. In the next section, we will explain why blood pressure goals change with age, and why lower is not always better after 60. Many people grow up believing that lower blood pressure is always better. For younger adults, this idea is often reasonable. But after the age of 60, the situation becomes more complex. As the body ages, arteries naturally become stiffer. This means blood flow relies more on adequate pressure to reach vital organs, especially the brain. If blood pressure is lowered too aggressively, circulation may not be sufficient during everyday activities such as standing, walking, or turning the head. This can lead to dizziness, weakness, or a feeling of being unsteady. Doctors who care for older adults are very aware of this balance. While dangerously high blood pressure should always be treated, pushing numbers too low can create new problems. Falls, fatigue, and reduced mental clarity are common concerns when pressure drops below what the aging body can tolerate. This is why blood pressure targets often change with age. What is ideal for a 40-year-old may not be ideal for a 70-year-old. Medical guidelines recognize this difference. They encourage doctors to individualize treatment rather than chase a single universal number. Another important factor is how blood pressure behaves during daily movement. A senior may have acceptable readings while seated, yet experience a sudden drop when standing. This condition is known as orthostatic hypotension and is taken very seriously by clinicians. Because of this, doctors ask key questions. Do you feel dizzy when you stand up? Do you feel weak after meals? Do you feel more stable at certain times of day? These answers matter just as much as the numbers themselves. Understanding that lower is not always better helps seniors avoid unnecessary fear. It encourages thoughtful conversations with healthcare providers instead of reacting to numbers alone. In the next section, we will discuss how posture and daily movement affect blood pressure readings, and why measuring at the right moment makes a real difference. Many seniors are surprised to learn that body position can significantly affect blood pressure readings. Blood pressure is not a fixed number. It changes as the body changes position and activity. When you sit quietly, gravity places less demand on circulation. Blood flows evenly, and readings may appear stable. But when you stand up, gravity pulls blood downward toward the legs. To compensate, the nervous system must respond quickly, tightening blood vessels and slightly increasing heart rate to maintain blood flow to the brain. In younger adults, this adjustment happens almost instantly. In older adults, the response may be slower or less precise. This delay can cause a temporary drop in blood pressure when standing. Some seniors feel dizzy, lightheaded, or momentarily unsteady. Others may not notice symptoms, but the change still occurs. This is why posture matters when measuring blood pressure. A reading taken while seated may look perfectly normal. The same person may have a much lower reading when standing. If posture is not considered, important information can be missed. Movement also plays a role. Walking, bending, or even turning the head can briefly change blood pressure. These shifts are part of normal circulation adjustment, especially in aging bodies. Doctors often ask patients how they feel when changing position. Do you feel dizzy after standing? Do you feel weak after walking or climbing stairs? These questions help determine whether blood pressure regulation is keeping up with daily demands. For accurate measurement, seniors are usually advised to rest quietly before checking blood pressure. Measurements taken immediately after movement may not reflect baseline circulation. Understanding how posture and movement affect readings helps reduce confusion. It explains why numbers may change without indicating danger. In the next section, we will discuss how hydration and daily habits influence blood pressure, and why small changes can have noticeable effects after 60. Many seniors do not realize how strongly hydration affects blood pressure. As we age, the body's sense of thirst becomes less reliable. You may not feel thirsty even when your body needs fluids. As a result, mild dehydration becomes very common in older adults. When the body is slightly dehydrated, blood volume decreases. This can cause blood pressure to drop, especially when standing or moving. Some seniors feel dizzy or weak without understanding why. In other cases, dehydration can lead to the opposite effect. The body may tighten blood vessels to protect circulation, causing blood pressure readings to rise temporarily. Daily habits also play a powerful role. Skipping meals, eating very salty foods, or drinking too much caffeine can all influence blood pressure readings. So can alcohol, especially in the evening. Sleep quality matters as well. Poor sleep increases stress hormones, which can raise blood pressure the following day. Many seniors notice higher readings after a restless night. Even bathroom habits can affect circulation. Straining or holding urine for long periods can temporarily alter blood pressure, especially in sensitive individuals. Doctors often look beyond numbers and ask about daily routines. How much water do you drink? How is your sleep? Do your symptoms change throughout the day? These details provide valuable context. Small adjustments in daily habits can lead to noticeable improvements in stability and comfort. This does not replace medical treatment, but it supports overall balance. Understanding the impact of hydration and routine helps seniors feel more in control. It explains why blood pressure readings can change without signaling danger. In the next section, we will discuss why home blood pressure monitoring can sometimes be misleading and how to use it more effectively after 60. Home blood pressure monitors are widely used, and they can be very helpful. But in seniors, they can also be misleading if not used correctly. One common issue is technique. Small mistakes in posture, arm position, or timing can significantly affect readings. If the cuff is too tight, too loose, or placed incorrectly, the numbers may be inaccurate. Another issue is body position. Crossed legs, unsupported arms, or leaning forward can all change blood pressure measurements. Many seniors are not aware that these small details matter. Timing also plays an important role. Measuring blood pressure immediately after walking, eating, or feeling stressed often leads to higher readings. These numbers may not reflect resting circulation. Emotional state is another factor. Worrying about the result can raise blood pressure temporarily. This creates a cycle where anxiety produces higher numbers, which then increase anxiety further. Doctors call this measurement-related stress, and it is common in older adults. Another problem is focusing too much on single readings. Checking blood pressure repeatedly throughout the day can magnify normal fluctuations. This may create unnecessary concern when no real problem exists. Doctors usually recommend measuring blood pressure at consistent times, after resting quietly, and recording patterns over several days rather than reacting to individual results. Home monitors should support care, not replace clinical judgment. They are tools, not final answers. Understanding the limitations of home measurements helps seniors use them wisely. It reduces fear and prevents overreaction to numbers that may not reflect true health. In the next section, we will explain when blood pressure readings truly require medical attention, and which warning signs should never be ignored. Not every unusual blood pressure reading is an emergency, but some situations should never be ignored. This is where many seniors feel uncertain. They wonder when to stay calm and when to seek medical help. Doctors look for specific patterns and warning signs. A consistently very high reading over time is more concerning than a single spike. If blood pressure remains elevated across multiple days, even at rest, medical evaluation is important. Sudden changes also matter. If blood pressure rises sharply compared to your usual range, especially with symptoms, this deserves attention. Symptoms are key. Chest discomfort, shortness of breath, severe headache, sudden weakness, or changes in vision should never be dismissed. These signs may indicate that blood flow is not meeting the body's needs. Another warning sign is fainting or near fainting. This can signal that blood pressure drops too low during posture changes or daily activity. Doctors are also cautious when blood pressure readings are low and symptoms are present. Feeling dizzy, confused, or unusually fatigued with low readings may require adjustment of treatment. It is important to understand that numbers alone do not define urgency. A high reading without symptoms may not require immediate action. A moderate reading with concerning symptoms may. This is why communication matters. Seniors are encouraged to report how they feel, not just what the monitor shows. Providing context helps doctors make safer decisions. Knowing when to seek help reduces fear. It allows seniors to respond calmly and appropriately. In the final section, we will summarize the key ideas discussed and explain how to approach blood pressure with confidence rather than anxiety after 60. As we come to the end of this discussion, let's take a step back and look at the bigger picture. Blood pressure after 60 is not about chasing a perfect number. It is about understanding how the aging body adapts and responds. We have seen that one reading can be misleading, that systolic and diastolic numbers behave differently with age, that posture, movement, hydration, sleep, and daily habits all influence circulation. We have also seen why symptoms matter. How you feel often provides more useful information than a number on a screen. Doctors who care for seniors focus on patterns, not isolated measurements. They look at trends over time. They listen carefully to symptoms. They adjust treatment with balance rather than urgency. This approach helps protect both safety and quality of life. Blood pressure management is not about fear. It is not about reacting to every fluctuation. And it is not about comparing yourself to younger standards. It is about calm awareness. Understanding your body reduces unnecessary worry. It allows you to participate in your care with confidence. It helps you ask better questions and notice meaningful changes. If there is one message to take away, it is this: numbers guide decisions, but they do not replace how you feel. A steady, informed approach leads to better outcomes over time. In future discussions, we will continue exploring how the heart, blood vessels, and nervous system change with age, and how seniors can support their health with clarity rather than anxiety. Thank you for taking the time to understand your body more deeply.